Propranolol is a non-selective beta-adrenergic antagonist used to treat hypertension, angina, atrial fibrillation, myocardial infarction, migraine, essential tremor, hypertrophic subaortic stenosis, and pheochromocytoma. In this video, let's find found. What is propranolol? What is propranolol used for? Contraindication. What are the side effects of taking propranolol? How does propranolol work? How to use propranolol? What is propranolol? Propranolol, sold under the brand name Inderal among others, is a medication of the beta blocker class. It is used to treat high blood pressure, a number of types of irregular heart rate, thyrotoxicosis, capillary hemangiomas, performance anxiety, and essential tremors, as well to prevent migraine headaches, and to prevent further heart problems in those with angina or previous heart attacks. Propranolol was patented in 1962 and approved for medical use in 1964. It is on the World Health Organization's list of essential medicines. Propranolol is available as a generic medication. In 2020, it was the 88th most commonly prescribed medication in the United States, with more than 8 million prescriptions. What is propranolol used for? Propranolol is indicated to treat hypertension. Propranolol is also indicated to treat angina pectoris due to coronary atherosclerosis, atrial fibrillation, myocardial infarction, migraine, essential tremor, hypertrophic subaortic stenosis, pheochromocytoma, and proliferating infantile hemangioma. Contraindication. Propranolol may be contraindicated in people with reversible airway diseases, particularly asthma or chronic obstructive pulmonary disease, COPD. Slow heart rate, bradycardia, less than 60 beats/minute. Sick sinus syndrome. Atrioventricular block, 2nd or 3rd degree. Shock. Severe low blood pressure. Side effects. An overdose of propranolol can lead to fatigue, hypotension, hypoglycemia, bronchospasms, and bradycardia. Bronchospasms and hypoglycemia occur because at high doses, the drug can be an antagonist for beta-2 adrenergic receptors located in the lungs and liver. Bronchospasm occurs due to the blockage of beta-2 receptors in the lungs. Hypoglycemia occurs due to decreased stimulation of glycogenolysis and gluconeogenesis in the liver via beta-2 receptors. Pharmacodynamic. Propranolol is a beta-adrenergic receptor antagonist used to treat hypertension. Propranolol has a long duration of action as it is given once or twice daily, depending on the indication. When patients abruptly stop taking propranolol, they may experience exacerbations of angina and myocardial infarctions. Mechanism of action. Propranolol is a non-selective beta-adrenergic receptor antagonist. Blocking of these receptors leads to vasoconstriction, inhibition of angiogenic factors like vascular endothelial growth factor, VEGF, and basic growth factor of fibroblasts, BFGF, induction of apoptosis of endothelial cells, as well as downregulation of the renin-angiotensin-aldosterone system. Half-life. The elimination half-life of propranolol is approximately 8 hours. The plasma half-life of propranolol is 3 to 6 hours. Dose. The dose of this medicine will be different for different patients. For acute heart attack. For oral dosage form, solution. Adults, 180 to 240 mg, mg, per day, given in divided doses. Children, doses based on body weight and must be determined by your doctor. For oral dosage form, tablets. Adults, at first, 40 mg, mg, 3 times a day. Your doctor may increase your dose as needed. Children, use and dose must be determined by your doctor. For adrenal gland tumor, pheochromocytoma. For oral dosage form, solution. Adults, 60 mg, mg, per day, given in divided doses, for 3 days, before having surgery. In patients who cannot have surgery, The usual dose is 30 mg per day, given in divided doses. Children, doses based on body weight and must be determined by your doctor. For oral dosage form, tablets. Adults, 60 mg mg per day, given in divided doses, for 3 days, before having surgery. In patients who cannot have surgery, the usual dose is 30 mg per day, given in divided doses. Children, use and dose must be determined by your doctor. For chest pain, angina. For oral dosage form, long-acting oral capsules. Adults, at first, 80 mg mg, once a day. Your doctor may increase your dose as needed. The dose is usually not more than 320 mg per day. Children, use and dose must be determined by your doctor. For oral dosage form, solution. Adults, 80 to 320 mg mg per day, given in divided doses. Children, doses based on body weight and must be determined by your doctor. For oral dosage form, tablets. Adults, 80 to 320 mg mg per day, given in divided doses. Children, use and dose must be determined by your doctor. Safety advice. Propranolol, like other beta blockers, is classified as Pregnancy Category C in the United States and ADEC Category C in Australia. Beta-blocking agents in general reduce perfusion of the placenta, which may lead to adverse outcomes for the neonate, including lung or heart complications, or premature birth. The newborn may experience additional adverse effects such as low blood sugar and a slower than normal heart rate. Most beta-blocking agents appear in the milk of lactating women. However, propranolol is highly bound to proteins in the bloodstream and is distributed into breast milk at very low levels. That's all the information about propranolol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.